So, before we discuss collaboration approaches, I think it's appropriate to first define the school based health provider. So, who exactly is this individual? Although school based health providers in Ohio can take several different forms from nurses up to physicians, the most common that we see in most Ohio schools is going to be the school nurse. And since this is my personal level of experience, I'm going to refer to the school based health provider as the school nurse for the remainder of the portion of this presentation. A lot of questions we get is, what do school nurses do? Despite popular beliefs, school nurses are not just there to put on band-aids and hand out ice packs to students. In fact, according to the National Association of School Nurses, the professional school nurse is considered a leader who bridges healthcare and education, provides care coordination, advocates for quality, student-centered care, and collaborates to design systems that allow individuals and communities to develop to their full potential. In other words, the school nurse plays an integral part in keeping children healthy and in school learning, and that's not a small feat. On this slide, you will see that I've listed some of the various roles the school nurse plays in the school setting, which not only include acute care of the ill or injured student, but also includes tasks such as care management of the student with special health needs, and of course, promotion of wellness and disease prevention. Next slide. So next, let's identify some of the infection control challenges that schools and the school nurse face in their day-to-day practice. So first, let's talk about congregate settings. We know that schools are, in fact, considered a type of congregate setting, and that children spend a majority of their day learning, eating, and playing in close proximity of one another. This, in and of itself, can play a significant part in the spread of infection, especially illness that's spread through airborne and respiratory particulate. We learned during the COVID-19 pandemic that proper spacing really can make a difference in reducing the spread of certain illness. However, this setup is rarely achievable long-term in the school building and creates a unique challenge in controlling infection control and spread in that school setting. Second, a lack of personal boundaries and poor hygiene practices is something that we see often. We know that children are not always the best at respecting others' personal space and tend to be in each other's spaces often, especially when they're small. Additionally, children and adolescents are not always the best at good hygiene practices such as washing their hands after using the restroom, covering their coughs or sneezes, and they even tend to eat and drink after one another. I feel like teens and athletes are especially guilty of this by sharing sports bottles and so forth. Another challenge are students who come to school ill or infectious. Sadly, we find that parents don't always keep their children home when they are ill. This happens when there's a lack of childcare, maybe there's an inability of the parent to stay home or missed work, or there may be other challenges we're not always aware of. Sadly, any school nurse will tell you that they have witnessed students come to their clinics just before lunchtime with a raging fever, only to have that student tell them that they woke up sick that morning, but the parent gave them medicine and sent them to school anyway. So as you can imagine, that sick student has now exposed their entire classroom all morning. And this is not an unusual experience, even when school policy states that they should have stayed home. Another challenge schools face is resistance to masking during respiratory illness outbreaks. Even in situations where masking would be appropriate for students or staff, by and large, we see a growing level of resistance to this practice. And so this also may create a challenge in controlling the spread of infection, particularly in that vulnerable and immunocompromised individuals during respiratory illness season. In a similar vein, we know that funding can also be a challenge for many schools when it comes to school clinics. So for school nurses to have access to appropriate PPE, as we discussed earlier in this presentation, that can sometimes be a barrier in and of itself. Yet another large issue schools face in infection control is suboptimal immunization rates, which we talked about earlier. While certain immunizations are required for K through 12 school attendance in Ohio, parents are permitted by law to exempt their child from those immunizations for philosophical reasons. Additionally, since the COVID-19 pandemic, we've seen increased levels of vaccine hesitancy for all immunizations, which has lowered the overall vaccination rates in Ohio schools. And sadly, we know that those lower vaccination rates, the higher the probability of a communicable disease outbreak we're going to see. Finally, the physical space and setup of the school clinic can pose a challenge. School nurse clinics see children of all ages, some healthy, some ill. Many clinics are quite small and rarely create an appropriate environment where sick children can be adequately spaced or isolated from other students who may not be ill. Additionally, school clinics may not have the option of that pre-visit triage or an ability to make appointments. So often, the school nurse has no idea what's going to be walking into her clinic door and has little to no time to prepare. So as you can imagine, this also can create a barrier in that protection against the spread of disease. Next slide. So the school nurse has several approaches when it comes to infection control within her school. First, we provide health education to students as well as to staff and even the parents and guardians of students, providing various kinds of health education on hand washing, covering coughs and sneezes, and avoiding the sharing of eating or drinking utensils, as well as promoting healthy eating and physical exercise, can help children to learn more about the importance of the development of these healthy habits. The school nurse also monitors the health status of the district. Ask any school nurse and they can tell you exactly what seems to be going around and in what grades or in what classrooms. It's through this diligent awareness that the school nurse can plan for and prevent further spread. Another important part of the school nurse's role is improving vaccination rates. Not only do they often monitor the immunization status of all the students, they can continuously provide education to parents and guardians on the importance of these immunizations and provide or often facilitate finding resources for them on where to get those vaccines. Particularly during cold and flu season, the school nurse is typically promoting flu vaccines as a primary prevention strategy as well. Regular communication with parents and guardians is a great outreach for the school nurse and is used often. This helps build trust between the family and the school and increases awareness of the health challenges that may be occurring at that time. In this communication, the school nurse can continue to reinforce the importance of staying vigilant of symptoms of illness and when to keep children home. And finally, school nurses partner with other school staff to help fight the spread of illness. Anywhere from working with the janitorial staff to target appropriate cleaning practices during certain outbreaks, to educating teachers and administration on how best to approach a rapidly spreading illness in the building, initiating this team approach can help make infection control measures more successful. Next slide. So when we consider best practice collaboration approaches between the school health provider, the school nurse, and the primary care provider for infection control, there are three main areas that are identified. First and foremost, communication and partnership. Good communication between providers really is a key concept. It is crucial to recognize the school nurse as a partner in the care of school-age children and to seek to preserve continuity of care through appropriate communication. One common barrier the school nurse often faces is the inability to have open communication with a primary care provider due to fears of HIPAA violation. However, it's important to note that HIPAA allows for communication with the school health provider without the need for written permission. In fact, the U.S. Department of Health and Human Services states, the HIPAA privacy rule allows covered health providers to disclose PHI about students to school nurses, physicians, or other healthcare providers for treatment purposes without the authorization of the student or the student's parent. For example, a student's primary care physician may discuss the student's medication and other healthcare needs with a school nurse who will administer that student's medication and provide care to that student while that student is in school. So having that knowledge, the primary care provider can feel more confident in their ability to communicate openly with the school nurse, thus opening the door for future collaborations of care. The next approach would be centered around communicable and infectious disease management. Ohio schools often follow the Ohio Department of Health Communicable Disease Chart guidance when it comes to managing communicable and infectious diseases in the school setting. This guidance may differ at times from the guidance the primary care provider may provide, creating some confusion for parents about when their child can and should return to school. One way the primary care provider can help with this is to review the most current and up-to-date public health guidance on infectious diseases with parents and families when they're in the office, so there's less confusion. And also by encouraging them to reach out to their school nurse for further information on the school policy. Another really important way the primary care provider can increase best practice collaboration is to have conversations with parents regarding school attendance. This conversation can sometimes involve the importance of keeping ill children home when needed, but it may also involve encouraging parents to send children back to school when they are well. As I mentioned earlier, some parents want their kids in school, sick or not, so having their trusted primary care provider reinforcing the importance of remaining at home while ill and infectious is helpful in reducing the spread of disease. And finally, providing return to school notes for children is very helpful in that communication piece. It assists in excusing student absences, but it also communicates any restriction or ongoing guidance for the student as they return. So, for example, if a child's been cleared to return to school because they're no longer infectious, but they need to be excluded from gym class for a week, this should be put in writing and communicated to the school nurse so that that provision can be made. Specificity is encouraged. Finally, school immunizations are another important collaboration topic. We've heard a lot about this today, but primary care provider awareness of Ohio immunization requirements for school entry is very helpful. The Ohio Department of Health does update this requirement yearly, so encouraging the appropriate vaccinations at each visit to avoid missed opportunity is a very valuable approach. Encouraging annual flu and COVID vaccines can also be helpful in reducing the severity and the number of absences due to influenza or COVID-19 infection. Additionally, primary care provider utilization of the Impact SIS statewide immunization registry to record any administered immunizations can help improve that continuity of care and communication with school nurses. Next slide. So to wrap up, I want to leave you with one final thought. When we work together, we can make a difference in the health and well-being of our children, our families, and our communities.